Good evening, everyone. Welcome to this epic crossover session where we will be talking about how to use Marrow during your MBBS period. I'm Dr. Rohan Khandelwal. I'm your Marrow surgery faculty. And today I'm joined by Dr. Abbas, who's the orthopedics faculty, and Dr. Ranjan, who's the pharmacology faculty. This session is extremely important because there is a lot of chatter regarding the next exam, regarding the change in the pattern. And so to highlight one key concept, I would like to start the session with a clinical case. So in this clinical case, we have a 52-year-old diabetic male who presented to the emergency room following a road traffic accident. And on assessment, he is found to have a bowel, and splenic and bowel injury along with a fracture shaft femur. The patient's vitals are unstable and he's being planned for an emergency surgery. But just before he is wheeled into the theater, the family tells the emergency staff that he has a deranged renal function because of long-standing diabetes. Which one of the following statements is not true regarding the management of this patient? So these are the typical questions which you're now going to get in your future exams, which will be long stem questions, and it will be an integration of various subjects. So if you look at the options, the first option is that the principles of ATLS should be applied in this case. Now you all know that ATLS stands for Advanced Trauma Life Support, right? Those are the guidelines which we follow in a trauma patient. And the ATLS guidelines are airway, breathing, circulation, disability, and exposure. And in airway also, it is cervical spine followed by airway. Why is the cervical spine important? Because if you don't support or stabilize the cervical spine, and if there's too much movement, that can even lead to paralysis in a trauma patient. So coming back to the question, yes, the principles of ATLS should be applied in this case. This is correct. And you should always rule out a cervical spine injury in a polytrauma patient. Regarding the other options and the importance of this case, I now hand over to Dr. Abbas, who will discuss the next option with you.
Thank you very much, Dr. Rohan. Hi, everyone. Thank you for joining in. So coming back to the question, as Dr. Rohan has nicely explained the importance of ATLS. The importance is that you do not make a mistake in the management of a patient in an acute setting, in a trauma setting, because you're likely to make mistakes in times of emergency. That's why this protocol is in place. Now, if you look at the third option, like A and C, both of them are true because what Rohan sir has already explained about the ATLS. But looking at the option B here, it says fracture femur should be treated before laparotomy. Now, as an orthopedic surgeon, I'll be very happy to manage the fracture. But I remember my boss telling me when I was a postgraduate that, beta, fracture is always attached to a patient. So if you treat the fracture and forget of the patient might die and the fracture treatment is useless. So please understand that fracture management is not an emergency. There are only a few fractures that require emergency management, and you will learn that later in orthopedic modules, but a long bone fracture is not an emergency. Here the patient is in shock, he's unstable, and he requires acute management of life-threatening injuries. Fracture here is not a life-threatening injury. So there comes the concept of damage control orthopedics, which you will read more in detail in orthopedics. But what I want to focus here is that the patient has already met with an accident and there is an insult and he's physiologically unstable. If you take him to the surgery to fix a fracture that is not causing any damage as of now, you can actually make things worse. This is what we call as the second hit hypothesis. We want to prevent this from happening. So that is why we temporarily manage the fracture and go for bigger treatments that can save the life of the patient, like a laparotomy or addressing the head injury or whatnot. So here the option B, which says fracture femur should be treated before a laparotomy, is a wrong option. You do not do that. You temporarily stabilize it and send the patient for bigger treatments, for major treatments, for treatment of life-threatening injuries, stabilize the patient. And once the patient is physiologically stabilized, you can take him for the definitive treatment of the femur fracture a week or two later. And for option D, I would like Dr. Ranjan sir to shed some light.
Hello guys. So pharma is like God, guys. It's everywhere. So without pharma, without drugs, we will not be able to treat patients. And you see, in this case, we are dealing with two things, guys, for which I would need to give antibiotics. So, anyways, whenever a patient goes for a surgery, for surgical prophylaxis, we always use antibiotics, right? Now, here, I have to keep in mind two things. One is bone fracture, right? So, there can be infection of bone, that is osteomyelitis, which is a complication of bone fracture, and the most common cause is staphylococcus. That is one thing I need to keep in mind. Second, in this case, there is bowel injury. And whenever there is bowel injury, there is a risk of infection of anaerobes, that is bacteroids. So keeping these two microbes in my mind, I'm going to plan for surgical prophylaxis. So the usual drug for surgical prophylaxis, which is cefazolin, is going to work here as well, because staphylococcus, which is gram positive, against it, cefazolin is much active. That is one thing. So with cefazolin, the regular drug, I would be able to cover the bone fracture part, right? Second part, guys, whenever there is an injury to the colon, or in any case, if I'm preparing a patient for colon surgery or colorectal surgery, I need to give drugs for anaerobes. And the most preferred one is, guys, we have studied, what is it? Metronidazole, isn't it? So metro is our first choice, go-to drug. If we don't have access to metro, then in that case, we can go for second generation cephalosporins, that is cefotetan or cefoxitin. Now, guys, in this case, I'll be giving metro plus cefazolin. Now, the problem here is the patient is having diabetic retinopathy, diabetic nephropathy, which means what? GFR is altered, it is decreased. So obviously dose adjustment has to be made in renal function for cefazolin, because cefazolin has renal excretion purely. Metro, on the other hand, you can give at same doses because it has both renal and liver elimination. So yeah, option D is correct, guys. Antibiotic therapy should be initiated after dose adjustment for renal dysfunction, particularly for cefazolin. So guys, it is a live example of how you are going to deal with patients in your life. It would not be just pure orthopedics or gynae or surgery or medicine. Sometimes you might have to apply your knowledge of multiple subjects into a patient, and that is what is called as integration, and for which Dr. Abbas would be able to throw some more light as a clinician, how he sees at this point.
Right. Thank you, Dr. Ranjan, for such a lovely explanation, and Dr. Rohan for the lovely explanation of the ATLS. Now, moving forwards, like Dr. Rohan has already said, that this is not an academic session. We are not here to brainstorm various types of MCQs and whatnot. We are here to understand how integrating the subjects from early on in your MBBS will help you in the long run, considering the pattern change of the exams that are going to happen soon. So based on that, what we did was we asked a lot of you these questions that were bothering you in terms of what you should do for preparing for such exams. How should you start integrating these subjects early on? And we have collected the most commonly asked questions by all of you, and we have prepared them here with us, and we will try to answer them together and hopefully clear the air about the various sorts of integration, vertical, horizontal, and whatnot, and why it is important as an MBBS student. Apart from this, we will also be reading your questions in the chat, and if we are going to address that, we will not address it immediately, and if it is something that we've already talked about, we will not address it. But if it's something important and something new, we'll definitely have a look at it and we'll start talking about it. Right. So the first question that I want to talk about, which was asked by a lot of you, is that when I study pathology or pharmacology, how can I practice applying the theory of these concepts in clinical situations? How do I make it more fun? So this was the question that was put to us, and I will try to start answering it, and hopefully everyone will start adding more information to it. See, if I were in your place and I wanted to make things fun and I wanted to understand what is the importance of a certain concept or fact, I will start asking the questions. I want you all to be curious and start asking the whys about anything that you read. For example, taking the cue from the previous question, say the patient in the previous question had kidney failure or renal function was compromised. Now, there are drugs that are metabolized through the kidney, and we cannot use it in this condition. So what are the alternatives that are available? There are drugs that are metabolized through the liver. We can suggest using that. Now, the question you should ask is, why does this disease actually cause kidney failure? That should be the question. And if the kidney failure is caused by this disease, what are the other alternative drugs that are available? And if it's an alternative drug that is available in the market, what are the other new side effects that it can cause? If you start asking these questions, you will start searching for the answers. And believe it or not, various new modalities of therapies and the new drugs that come to the market basically are an attempt to solve a pre-existing problem. And if you start thinking like this, and if you start thinking for solutions, you'll become more curious, and you'll have fun reading the stuff that you're reading, which apparently looks dry, but then starts making sense to you. And who knows, maybe down the line in the future, you'll be inventing a new drug or a modality of treatment. What do you say, Dr. Ranjan? Do you agree?
Well, so the question that they have asked, how to have more fun, right? So when you stop having fun with medical science is that when you start mugging up things, right? You start mugging up things, and going forward, what happens is everything that you have mugged up, it is evaporated, right? Spontaneously. So when you reach to a second year, right? Let me talk about pharma. When you're a second year student, and when you go through a textbook, right? And you read through antimicrobial drugs, let us say, for example, or let us say you are studying about Parkinson's disease. So you know that pharmacology will give you an aspect into how drugs act in PD, how they increase the level of dopamine or they stimulate D2 receptors, and how the effect would be seen. But at that time, guys, if you're not gaining interest in the topic of PD or any topic in pharmacology, then what you need to ask yourself is, do you remember, right, what kind of disease PD is? I mean, what happens in PD in corpus tritum, right? So if you cannot recall, just go back to pathology and see, right, what happens in PD, Parkinson's disease. Now, while you are studying pathology and PD, ask yourself, do you know the physiology of corpus tritum? I mean, what is the role of dopamine in corpus tritum? Now, if you cannot recall, go back to physiology and thoroughly revise your physiology, right? So what happens when you come to second year, most of the physiology and this facts in first year, which you would have studied, most of that, it gets evaporated, and it's all right, it's fine. We are all human, right? But don't feel shy to go back to those subjects, right? And that is way how you'll be consolidating. And see, when you begin to understand things, when things start making sense, that is when you start enjoying a particular subject. So guys, usually what happens is, from 90 subjects, many of us say that this or this particular subject is the subject I love the most. And if you go retrograde and see, what happens is that is a subject where you would have invested your soul, mind, and body into. So if you can do this from the very first year or second year, guys, then it will become all fun. And as Dr. Abbas has said, in medical science, right, if you don't ask the whys and hows in medical science, you're not going to learn things. You're only going to mug up things. And if you mug up things, by the time you reach your final year, believe me, everything from your pre-paraclinical first year, second year would be gone. It would be evaporated. So don't do that. Try to learn in a way by which you can learn concepts. So that is what, guys, our aim is in Marrow. In Marrow, what we try to do is we try to give you an integrated approach. So if you look at any topic in pharma, whenever I begin with any topic, like let us say hypolipidemics, I'll begin with biochemistry, the aspect of how lipids are metabolized and how they are generated in our body. Then I tell you how the drugs they act. So this is the way forward. You need to integrate the pre-para subjects and then integrate them with the clinical subjects. Then you'll see that these subjects will start speaking to you, right? And it will be fun. What do you think, Dr. Rohan? What do you say about this?
So I think so. Dr. Abbas and Dr. Ranjan have already covered most of the important points regarding this question. Now, everyone's definition of enjoyment and fun is very different, right? I would just like to add that another way to make your studies fun is to do group study or to discuss it with somebody else. And that always helps in better understanding. Me and Dr. Rila were batchmates, and a lot of times we used to discuss dull subjects like pharmacology. Sorry, Dr. Ranjan, I'm making it a dull subject, but it slightly is.
I
You did
completely
not
know
have
my
Dr.
subject,
Ranjan
sir.
to teach you then, Dr. Rohan.
I
That's why
completely know my subject. I know
Yeah,
whom to merit
so
to.
so discussing it with in a group always helped, and that ways we were able to cover our Robbins and our pharmacology books with a lot of ease. So that's another tip which I would like to share with you. Now, before I move on to the next question, I can see that the chat box is flooded with queries regarding Next. I know there was some recent announcement which was made regarding Next. So be rest assured, we are going to answer all your queries regarding Next as well. You just need to be patient. What we are covering first are the top queries which we had received from all of you before we planned this session. Okay. So moving on to the next question. How can Marrow help us in building our confidence in clinical cases? As being at home, our clinical postings are suffering and practical classes are suffering. It's affected our confidence in clinical field as well. Well, all of us are going through a very tough time, and I do understand that because of the COVID period, you're not actually having patient interaction, and that is a bit of a drawback being an MBBS student. But things never remain the same. Things will gradually improve, and hopefully, in a few months, colleges will restart. And once they restart, you will get ample opportunities to examine patients and to hone your clinical skills. For the time being, all Marrow faculties, the clinical faculties, have made a sincere effort to add clinical cases along with history taking and examination so that we can fill this void of your physical clinical classes which are suffering right now. So go watch those videos and they will be useful for you and they will prepare you for the time when you actually enter clinics again. Would you agree with that, Dr. Bas?
Absolutely, Dr. Rohan. The first thing that I would like to reiterate what you just said is that all the teachers, whether they are the clinical teachers or the non-clinical teachers, they have brought a lot of clinical information to the content on Marrow, thereby putting you in a position, even though that you're missing out on the clinics, you will be learning all the things that you would probably pick up on the rounds. I will not say that everything can be compensated, but most of it is. So please pay attention to that. The fact that Dr. Rohan mentioned that. Also, surgery, medicine, and obs and gyne, all the three major subjects, they have introduced a lot of clinical case discussions based on history taking and the detailed examination. You can have a look at it and you will definitely find some peace with that. But the most important thing that I want to talk about is, let's be honest with me and tell me, all of you, how many of you actually go to the clinical postings fully prepared? Have you read the manual? Do all of you have the manuals? When I go to the postings and I take classes for my students, most of them don't even have their manuals. So they have not seen it. So you're usually underprepared. But this time gap that you have right now, you can actually utilize this and prepare yourself so that when you go to the actual wards later in the future, you should be able to know what you need to examine and how to do it. And only then, when the teacher starts to show you things, you will be able to appreciate it. I have seen a lot of great teachers get frustrated when the students do not understand what they're trying to show because the students have not come a little prepared. So this is the time you can use to watch the videos and learn the basic clinical information, and then go to the wards and understand what the teacher is trying to teach you. Don't make the grave mistake of pulling out the knee hammer when someone asks you to elicit corneal reflex. Don't do that. Understand what are the instruments you need and how to approach a patient, and all of this can be picked up just by listening to the teachers on the platform. And as far as the confidence is concerned, trust me, confidence comes with knowledge. The moment you acquire that knowledge, you will feel more confident approaching the patient, touching the patient, trying to feel for that spleen, trying to feel for that liver. So I appreciate that you have difficulty right now, but it's very temporary. Get prepared so that you can use the most of your time actually examining the patient rather than just moving around here, there in the wards. Dr. Ranjan, what do you say?
Yeah, well, guys, it can be least said that these are difficult times, these are trying times, and you are in your right composure to ask this doubt that you're not getting clinical exposure, because at the end of the day, medical science is all about application, right? So you learn about signs and symptoms, etc., but you need to practice them on patients, live patients. But we can't do anything about the situation, right? It's still, the COVID is lingering on, but you know that one day this COVID is going to blow off and the life will come back to normal. You can go back to your clinical postings and you can practice all these signs and symptoms and have a look at these patients and make your diagnosis. But till then, guys, you don't need to sit idle. You need to keep practicing virtually, right? So virtually, as you have seen, guys, in Marrow we have started integrated clinical sessions, which is the closest possible way of giving you a clinical feel of how the patient comes to you, what it tells you, and how to make a diagnosis and how to go about the treatment part. So follow religiously those clinical integrated sessions, guys. And remember, life is never perfect, right? There would be imperfections, and you'll have a lot of troubles going forward into your clinical life, into your adulthood life. But you need to find the solution. Finding the solution is the key. And look at the brighter side of it, guys. At least, right, when you grow old, and you would have some stories to tell your grandkids about how you survived this COVID pandemic as a medical student, right? So they'll look up to you. So we can move on to the next question. As a second year student, when should I start preparing for the PG entrance exam? And given the uncertainty around the exam patterns, what should be my strategy? It's a beautiful question, guys. And when should I start preparing for the PG entrance exams? Now, if you look at the MBBS curriculum, and let us talk about the subject pharma. Pharma is pharma, guys. The same drug is the same digoxin, is the same atropine. It's not going to change for your prof exam and for your PG exam. And there is the reason why, while you are preparing for your undergraduate exams or prof exams, simultaneously, guys, simultaneously, you need to keep preparing for your PG exams as well, right? Why I tell this, in the beginning also I told you that you need to focus on concept, right? You need to understand the whys and hows, and you need to store all this information in your notes, so that when you go to the final year and prepare for the exam, you would not have to reinvest so much of time as you had invested when you are a first year or second year student. Now, what you have asked is uncertainty around the exam patterns. What should be my strategy? Guys, I'm a firm believer of, does not matter what pattern of exam is there, which country exam is it? Is it Indian exam? Is it NEET? Is it Next? Is it USMLE? Is it PLAB? Whatever exam is it, guys. If you focus on concepts, and as we said in the beginning, the whys and hows, any exam, guys, would be a cakewalk for you, right? Apart from that, obviously, the question practice is important. So we'll talk about question practice and Q bank, etc., in the coming time. But yeah, guys, as a second year student, you should start preparing from the second year itself, right? So what do you think, Dr. Abbas? What would you like to say to the students about this?
I agree with you totally, Dr. Ranjan. And like you said, if you prepare conceptually and understand what are the concepts that are tested, and you remember the facts that are asked in your exam and keep on revising it all throughout your preparation in MBBS, there is no exam on this planet, like Sir said, that you will be unable to answer on. Because every exam, every question on every exam at your level is actually asking questions that have answers already there in your books. So nothing is coming out of those books. So if you start thinking like that and understand that everything that is going to be asked in any exam, whether it's like Sir said, NEET PG ho, Next PG ho, USMLE ho, uske answers, all the answers are there with you in your books. All you need to do is understand where they are and understand what they are and memorize them. That's all that is required. And if you think that preparation for an entrance exam, whether it's NEET PG or Next PG or whatever, is a totally different entity and it requires separate preparation, you're making a huge mistake. It's not. It's all the efforts that you're putting in now. It's an amalgamation of your life as a medical student. Questions can be asked from the things that you observe in the wards, from the things that your professor randomly told you when you asked a question. So if you put in effort from now and just do everything a normal MBBS student does, you will be ready for exam. The thing is, you just need to know what are those key concepts that are tested and what are those facts that you need to memorize. And for that, I'll tell you that question bank will help you identify what those concepts and facts are that you need to put in effort. Otherwise, there is an ocean of information, right? So I think rather than worrying about how you should start preparing and what your strategy should be, take each year as it comes and just focus on the subjects that you have at hand and look at the concepts and facts that you need to put extra effort on, and you will be ready by the time you finish your MBBS. What do you say, Dr. Rohan?
Well, the question says that as a second year, when should I start preparing for the PG entrance? I personally feel, why even wait till the second year? I've already written down that the concepts are going to be the same. Exam pattern might change. It's just a different packaging. The concepts are going to be the same. So start learning your concepts from first year. And as Dr. Ranjan said, whether you're preparing for your prof exam or your PG exam, if your basics are clear, you will do well in both. So why even wait till second year is point number one. And if you're in second year, you should start as soon as possible. Okay. Build concepts. MCQs should not be your prime concern in second year, and we'll address this question later on as well. Your prime motto in first, second year is to make good notes, which will be helpful for you in the future, and to understand concepts. Okay. With regards to integration, as you start going more and more to clinics, you will be able to apply the pre and the paraclinical subjects in the clinical sense as well. And for the meantime, till the clinical postings are not happening, watch the integrated sessions where we've tried to practically apply the concepts of pre and paraclinical subjects into the clinical subjects. Moving on to the next and the very important question, when is the next exam going to be conducted? And I guess a lot of you are attending this session just for this question to be answered. And it is a very tricky one. And I'm the one who has to speak on this first. So I'm a bit lost for words, because these are policies which are unfortunately not made by me. They are made by the people who are higher up. But what we've been hearing is that, till a few weeks back, we were hearing that it's going to be conducted next year. Now, some people have shared a notification today which says that it will definitely be held in 2023. So 2023, yes. Next year, maybe. But again, do things change? No. Prepare your concepts, study for a normal entrance exam. The packaging might change, but the concepts will remain the same. Would you agree with that, Dr. Bas?
I would absolutely agree with you. But since we are already on the topic, would you just want to take a few seconds and roughly explain, because a lot of students are asking in the questions in the comment section, what would be the pattern? And I'm sure you're aware of the pattern. Just let them know what the pattern might involve, because there is no point in discussing the date, because it is not very clear, and also not a lot of information is there in the pattern. But like you mentioned in one of your previous sessions, that there are two nexts and the division of the subject. So a rough idea of what it is, so that students know the importance of it.
Sure. So the next exam will be conducted in two parts, next one and next two. And the next one exam is going to be before your internship. So that is one major change. Till now, the exam was occurring after internship. This exam is going to occur right after final year. So effectively speaking, you have one less year to prepare for your entrance exam. And this exam is not only going to be your qualifying exam for PG, but this is the one which will also give you your MBBS degree. So if you clear this exam, you become eligible for internship, and you get your MBBS degree, and you get a PG seat. So it's actually a 2-in-1 or a 3-in-1, which is why it becomes a high stakes exam, right? In the current scenario, you can appear for the exam multiple times. Here, there is another very tricky guideline which said that probably only 2 attempts. Well, people are challenging that. We still don't have clarity regarding that. But it is definitely going to be a high stakes exam. And we are moving more in the format of the USMLE pattern, where it's a single exam. There also stakes are extremely high. And in the next one exam, another major change is going to be that it's going to be a 3-day long exam. Till now, the NEET exam is just 3 hours, right? And everyone puts their full attention into those 3 hours into solving the question. But imagine having a pre-lunch and a post-lunch session for 3 long days. That would require a lot of mental and physical strength as well to get over that exam. And it's going to be heavily focused on the clinical side. So medicine, obs, gynae, and surgery are going to form 120 questions each. And ENT, optha, and orthopedics are 60 questions, if I'm not mistaken, Dr. Bas. Ortho is also 60?
It's surgery and allied, medicine and allied, and obs and gynae.
Yeah, so ENT, optha, and the third day is also
community medicine.
Okay. So those are going to be 120 in the pre-lunch session and 60 in the post-lunch session. So this is the next one exam. And once you clear the next one exam, you can do your internship. And next two is going to be a practical exam or an OSCE exam, which is going to be after internship. And only after you clear the next two exams can you start your post-graduation. And this is basically going to test what you've learned during your internship, because a lot of times what used to happen was that students, to prepare for the entrance exam, they did not do their internship well. So the practical skills were missing. And a lot of times we've seen our first years joining and they don't know the basic skills like Foley's catheterization. So this exam will address those problems and will test the basic procedures or concepts which an intern should know. Over to you, Dr. Bas.
If I can add here, I think there was an error on my side. It's not ENT Ophthal SPM, it's ENT Ophthal and Pediatrics as a package of 120 sub.
Correct. Yes, sorry.
Right. So essentially, a lot of students are right now asking what is the value of first and second year subjects. And this question has been asked so many times and it's not funny anymore. The point I'm trying to make is, how can you speak a language without understanding the alphabets, without understanding the words? So if you want to be able to answer a clinical case-based scenario, you should be able to appreciate the laboratory findings, the radiological findings, the basic biochemistry, the pathology, and the correlation of pharmacokinetics and pharmacodynamics, the organism, the microbiology. So essentially, all of these subjects matter. They are very important. They are the basic, the words, the fundamental alphabets that will make your clinical subjects. So just don't think that it's all medicine and surgery and orthopedics and ENT and ophthalmology. They are all there, but they heavily rely on understanding your pathology and the pharmacology and the microbiology and physiology and whatnot. And we have shown it to you just right now with that case scenario. So if you prepare, like what we have already discussed in the previous questions, if you start preparing conceptually and understand what facts to remember, I think it doesn't matter whether it's next 1, 2, 3, 4, you will be prepared for every exam. And come what may, please understand that the moment the news becomes official, Marrow will be the very first to pivot and change and adapt for the best possible solution to your next exam. What do you think, Dr. Ranjan?
I think so. I'm sorry, I'm interrupting. I think so. We've already added the integrated concepts and the long stem questions in the Q bank. So we've already started changing. But as Dr. Bas is saying, a lot of it is still hearsay. It has not become a well-defined policy. And the day it becomes a well-defined policy and the announcement is made, you will see a major change in the approach towards the exam. Would you agree with that, Ranjan sir?
Yeah, guys. So to begin with, when is next exam gonna be conducted? See, even the planned exams, they are being delayed nowadays because of COVID. And frankly speaking, we don't know how is COVID gonna behave, how many mutations it is gonna have, and if humans would become mutants after that, we don't know. Right. So we don't know a lot of things, guys. So I personally, if as a student, would not lose my sleep over when next is gonna be conducted. Rather, I would focus on what am I supposed to do if next is gonna happen. Right? What should be my preparation? How should we prepare? So, guys, frankly speaking, the trailer of next, right, would be your NEET PG exam this time, because they have decreased the number of questions with the same amount of time you used to have for NEET PG. So just you think yourself, I have lesser number of questions, I'm having more time, which means what? The questions are going to be lengthier. The questions are going to be clinically oriented. And For that, those long questions, they would test your decision taking capability, right? You would feel that every question would be like a patient comes to you, and you would have to take a decision. Should I go for an X-ray or CT scan or MRI, or should I go for a cephalosporin or penicillin or whatever treatment I need to do that? So that is what they're trying to do by implementing Next. That is, they're trying to give you an insight into how you should be confident going into the clinical field with a developed decision taking capability. And obviously, as Dr. Rohan has said, we have started working towards that in Marrow, and long stem clinical cases and clinical VNA, we have started updating those. And guys, as the time changes, right, you know that evolution is a constant process. It is never going to stop, and we always try to evolve with the changing trend or pattern, whatever it comes. Don't worry, you are in safe hands. So we can move on to the next question. What is the role of integration in current scenario, and how will it be beneficial for Next? So guys, it is essentially an extension of what we had been discussing until now. That is the question, as I said, the number of questions is going to decrease, and the questions would be highly clinical. And in such cases, questions would be asked where you have to utilize your knowledge. See, just think about it. Whenever a patient comes to you, suppose you're an MD medicine guy, right? A patient comes to you, and he is having some kind of disorder of the lungs, right? Some disorder, he's having cough or dyspnea or whatever it is. So now what do? You will advise him for a chest X-ray, right? Chest X-ray. Then you advise him for some biochemistry test result, or if it is a case of infection, you'll go for some culture sensitivity. Which means what you're putting together as an MD medicine, not only your knowledge from medicine, right, the symptoms, but also your knowledge from radiology, right? What would be the finding? Obviously, you would be relying on the radiology guy, but as a medicine guy, you'll be utilizing your own knowledge about those findings from the reports of microbiology or biochemistry. So you integrate all these things and put that knowledge into one patient and try to give the best possible treatment for that patient. So this is integration, and it is not a new thing. It's not a new thing. Is happening from the day we have started medical science. Every patient is a new integration for a clinician. Now what we are doing is the clinical pattern, the exam which is changing is they're bringing it into your study room, right? Into your study room. So they're giving you an insight into how to integrate tomorrow when you become a clinician, so that there is not much of a lag period. See, when you go to the clinical field, the initial days are difficult. You are not confident because you have not practiced about this integration. But just imagine moving forward, when you would have practiced this integration, how easier it would become for you guys. And it is a boon. I think it's a great thing. What do you say, Dr. Rohan, about this?
Yes, so I think so. Ever since the start of the session, we've been talking about integration. And as Dr. Ranjan has mentioned, that clearing the exam and integration for the exam is just one small aspect of the bigger picture. The bigger picture is that you actually have to treat patients in future. And no patient is going to have a tag written on their forehead that I'm an orthopedics case only or I'm a medicine case only, right? There are usually multiple things involved. So the more you integrate, the better it is for your preparation and better clinicians you're going to become in the future. One very important thing regarding integration, and this is something which I can share from my USMLE days, that integration also helps you in retaining facts for a longer period of time, right? So it happens so many times with us that whatever anatomy I read in first year, by the time you enter clinics in second year, you forget a lot of that anatomy. But once you enter the clinical posting and your surgery professor teaches you surgical anatomy with the clinical perspective, you will remember both the anatomy part and the surgery part for a longer period. So that is another big advantage of integration. It helps you to retain facts for a longer period of time. Would you agree with that, Dr. Bas? You are a professor in a college and you teach these students coming to the postings every day. Is this your experience as well?
Absolutely. There are a lot of times what happens is when these fresh first year students who pass out and come into the second year and they start their clinical rotations, and they are actually mixed with a lot of senior students who are either third year or second year students. And in the rounds, both of these batches are mixed together and the questions are asked by the professor. The senior will not be able to answer a lot of basic questions compared to the junior. The junior remembers his anatomy because it's fresh passed out. The point I'm trying to make here is that it doesn't matter how much you read in the beginning. You will understand its importance only when you start integrating it clinically. And when you start integrating it, you will understand why it is important and why do they constantly keep asking you what is the medial relation of the radial nerve, what is the lateral relation of the brachial artery. You will understand the importance. Otherwise, it's just a fact that you're memorizing. So essentially, medical science was always an integrated science. We actually had to break it down to simplify its consumption. Otherwise, we wouldn't have been able to consume it. With that said, understand that the next exam and the scenario for the next exam will be just like this. They will give you a clinical case with a lot of lab findings and radiological findings, which means that you should be adept with the lab values from biochemistry, from pathology, and the renal parameters that can affect the drug interaction from pharmacology, and the radiological presentation of that disease. And then you will have to make a diagnosis. And from that diagnosis, they will ask you the management. That is when the clinical medicine or the clinical surgery or orthopedics comes in. So these are all integrated, whether you like it or not. We are training to become doctors who treat patients, not doctors who can sit down and answer MCQs. And that's all I want to say about this question. So shall we move on to the next question?
Yes, sir, please.
So the next question is how to prepare for university exam and next exam simultaneously. Wow. So university exam and next exam simultaneously. See, like I said before, and like how all the teachers have said previously, the preparation starts from day one. You have started your preparation. Doesn't matter where you did it from. You've already started your preparation. Now, while preparing for your professional exams, this is what I suggest you do, keeping next or your entrance exam in mind. Read the standard book that you have, right? Read the standard book that you have, attend the classes from your medical college, and then do the MCQs. Now, my opinion might differ from the other teachers and let them shed some light here, but this is what I would do. Read the textbook, attend the classes, then go to the MCQs in the question bank. Start answering them. If you can score more than 70% in the Q bank, it means that your concepts, your understanding of that topic is rock solid and you don't have to worry about it. But if that is not the case, and if you're not able to score that much in the question bank, and remember, question bank is the thing that will show you what are the important concepts and facts you need to remember. Otherwise, there is an ocean of information and you will be lost. So if you can't score 70% in the question bank, it means that you're not up to the standard with that concept or fact or information. Go back, watch the videos, make the notes, and add the relevant points wherever. You can add it to the textbook, or you can make a separate notebook. That's your choice. Now, by doing this, what have you done? You have identified what are the key concepts that you should know at this stage. What are the facts that you are likely going to be tested in your exam? You've understood this, you know what they are, you've identified them, and now you start mugging them up and understanding them. What will happen is it will give you a canvas of information which you can paint for your professional exam and get the marks that you need, and then also be ready for the MCQ exam. So essentially what I'm trying to tell you is use the question bank as a tool to identify where you need to focus on in the ocean of information when you're studying as an MBBS graduate. If you open pathology, there is so much information to read. But if you do the question bank, you will know what you need to focus on. And if you have trouble understanding some parts of it, watch the videos. The teacher will explain it to you in great detail. And while listening to the video lectures, you will also notice that most of the teachers have also highlighted the points that the examiners love asking you in your Viva exam. That way, it will help you in your Vivas as well. What do you guys say?
Well, see, as university exam, next exam simultaneously. So we have covered this little bit in the beginning as well. And that is, as I have said, the subjects, they don't change, right? As you move forward, these are the same exams. The only difference is, see, university exams, see, if you are a guy who is just mugging up, right, you might perform well in your university exam. But going forward, when after 4 years you are giving an exam that is an exam like next, you tend to forget all those information that you have mugged up in your first or second year. Right, that is the basic difference. So you might be a university topper, but you might not perform well at the end of the day if your way of learning things is just mugging up. But if you're learning it by the way of concept, that is understanding the whys and hows from the very beginning, your first year and second year, then you would see that you will tend to remember those things for a longer period of time. Or otherwise, when you go to the final year and take out your notes of first year or second year subjects, you brush up and you'll be raring to go only if you would have understood in first year and second year how and why of those subjects, right? If you would have mugged up, you'll need the same amount of time again in fourth year, and you would not have that much of patience when your clinical subjects are going on in final year. So guys, yes, that should be the key. If you're keeping your next exam in mind, prepare in such a way that you're understanding things, right? While you're making your notes, keep it in your mind that you're not making these notes only for your prof exam, right? Keep in mind that you're gonna save these notes for eternity till the end of your life, and you can just brush up or add on to those notes before the exam. It will save you time as well, right? And based upon that, guys, just you can be ready, prepared for any kind of exam, be it your university exam or be it your next exam, and guys, you'll rock, believe me. What do you say, Dr. Rohan?
Yes, so as Dr. Ranjan mentioned, having these notes and saving them for the exam is very important. And up till now, all Marrow faculties have been, very clearly saying that by the end of final year, if you have your 19 registers, one for each subject, and the 20th notebook, which contains your volatile facts, you are all set for your internship, because in your internship you just have to refer to those 19 and the 20th notebook. So there is that clarity which is there, that I don't have to open up ab mujhe ye book nahi kholni, I don't have to open up this thing. That clarity is very important while preparing for any entrance exam. And now what is going to happen for 2018 batch, it has been confirmed that next is going to be there. 2017, if I was a 2017 batch student, I would prepare with the next exam in mind. But all juniors who are in first, second, third year, you need to realize that you have 1 year less to prepare. So you don't have the liberty to prepare during your internship. And that is the key statement here. You don't have the liberty to prepare during your internship. So you should build strong concepts and make good notes right from first year. So if you're a first year student, by the end of first year, your first year subject notes should be complete. Dr. Abbas has mentioned that you can use QBank as a learning tool. You can, but I would not go out of the way to do the QBank. If you have time, you solve the QBank, but your first priority should be your notes, good notes, which you can add on to later. You can watch the Marrow videos, you can supplement facts in your notes. Similarly, second year, you should make your notes by the end of second year. Third year, you should make your notes by the end of third year. In third year, towards the last 3, 4, 5 months, you should also start working on your fourth year subjects, because fourth year subjects are the most vast subjects and you will just have 1 year to cover them. So you need to start early to finish your fourth year subjects on time to be ready for your next exam as well. Would you agree with that, Abbas sir and Ranjan sir?
Absolutely. And I would like to highlight once again what Dr. Ranjan and Dr. Rohan sir said. I loved what Dr. Ranjan said here. He said, these notes that you make for that subject should be there with you for the rest of your life. And he's bang on target, because there are a lot of times I have to review a certain anatomy for case discussion or for my presentation. I would actually go back to the notes that I prepared for my preparation then, because it will have all the important facts written next to it. And sometimes I have to refer for biochemistry. So what I'm trying to say is, and like what sir said, these notes should be your God notes. This is Ranjan sir's favorite word, God notes, and that should be perfect. And like Rohan sir said, if you can focus on building those notes in each respective year, you have done a good job. Because if you have not, then you will be overburdened with so much task with a huge task of writing the notes in your internship, and that will not help. So if you use first, second, and third year for preparing those god notes, you will be ready to sail through the exam, come what may. So that should be your aim. Moving on to the next question. The next question is, can I use Marrow for my professional exam preparation? Is it enough? Now, the question is asking Marrow for professional exam preparation. Yes, of course you can use. But is it enough? Now, this is an extremely controversial question, but there is no controversy for me because I feel that nothing is perfect. What I feel is, for a good student to become a good doctor, developing the habit of reading books is important. And once you develop that habit of reading stuff, you will be able to sit in one place and consume a lot of information on your own. This is an important skill that will help you later in life. Let me tell you why. See, nothing can replace a standard textbook and attending your college classes, because that's the point of the college. You go there to listen to the teachers. Now you can sit down at home, and many students I know make this mistake. They only listen to, they only watch the videos or do the question bank, and they don't pay attention to the teachers in college or read standard books. But you're missing out on a huge opportunity to understand a same concept from different angles. So if you read something, and if you say you listen to the teacher teaching you the same thing once you have already read, you will find a new dimension to that same topic, and you will understand it better. And then if you watch a video or you do the question bank, another dimension is added to that piece of information. Thereby, your knowledge will become deep and multi-layered. This is an extremely important exercise that if you start doing right now, it will make you a very good, a student, not only for exams, but also as a clinician practicing. What do you think, Dr. Rohan?
I completely agree with you. And this is what I've highlighted in my Marrow videos. In fact, all 19 subject faculties in Marrow, the first video is how to prepare that subject using Marrow, right? And in that video, all Marrow faculties have spoken about how to prepare for your professional exams, how to prepare for your entrance exams using those videos. And like I say in my preparatory video, that Bailey is very important. But unfortunately, Bailey has written everything in a very concise manner. And even as a surgeon who's read Bailey multiple times, when I read it now, I pick up new things, right? So as an undergraduate, my recommendation is that before you read Bailey, you should watch the video, get the concepts clear, and then when you read Bailey, you'll be able to understand Bailey in a much better manner, and you'll be able to pick up those one or two extra points which might be the game changer in the exam, either your theory exam or your viva or the PG exam. Okay, now slight extension of this question, and I can see a lot of comments regarding that, is that should all of you, you're saying that is reading books mandatory? Well, when all of us were preparing, and I guess Ranjan sir and Abbas sir would agree, all of us did not have the luxury of having Marrow with us, right? So all of us have prepared using standard books, listening to college classes, and then whatever extra we could manage. So if you have the time, if you can spare some time, reading books is always beneficial. As Dr. Abbas said, it gives you multi-layered information. It is another strategy for spaced revision, which would help you retain facts for a longer period. Would you agree with that, Dr. Ranjan? Reading pharmacology books?
Well, see,
Before
guys,
sir answers that question, I just read a comment here saying, Doctor, thanks Ranjan sir, his content is even more than Katzang.
no, guys, it's not like that. It's not like that. See, what happens is actually, uh, it's about if you compare the videos and notes in Marrow, and if you compare to a textbook, obviously, I mean, it's humanly not possible to cover each and everything in a textbook in videos and notes. But the videos and notes, they contain the 90% of the most important information which you are going to need even in your clinical practice, or you're going to need for your exams, right? So we cover basically most of those facts, but still you need to make a habit of studying textbook. Why I'm saying this, guys, is the reason being, you would see that tomorrow when you become a clinician as well, an OBG or surgeon or a medicine guy or an ortho guy, you'll see that you would have to read textbooks even after you clear your exam, and even after 5 to 6 years of practice, you need to constantly keep yourself updating. So you need to make that habit of reading textbook from the UG days as well. So whenever you take a topic in a textbook and go through it, right? So don't be harsh on yourself that I'll cover 50 pages of a textbook in one day. No, that is not possible. So what you can do is you can begin with a topic, right? Let us say in pharma, you'll begin with anti-arrhythmic drugs, go through the videos, right? If you're using the notes, just mark the important points in the notes, get a clear picture, understanding of that topic in your head. Now, once you have understood that, now when you go to a textbook, right, any textbook, and you'll go through the textbook, then you'll see that you'll need much more less time than you would have required to cover the textbook. But I would still advise, if you have time, please make it a habit of reading textbooks, because that is going to help you tomorrow as a clinician as well.
So
So
Dr. Ranjan is absolutely right. And Dr. Abbas would also agree with this. Even as surgeons or orthopedicians, and I practice a very niche branch of breast cancer surgery, still there are cases for which I have to read up. I have to plan my incision. So reading textbooks is very important. They give you another aspect towards understanding that subject. Now, some of you are posting in the comment section that should we watch college online classes? They are very boring. What would you have to say, Dr. Abbas? I'm sure you are also conducting those online classes for colleges.
Well, not my classes, Dr. Rohan.
No, I know your classes cannot be boring, but
But yeah, but
what
this is
about the
again,
question in general?
yeah, the question, I mean, they are right in the sense I have to kind of side with them here. It is boring because number one, the timings. A few colleges have morning Zoom classes at 6 o'clock in the morning. So yeah, the timings are difficult. But if you come prepared, if you read a little bit and then go to it, whoever the teacher is, he is definitely in a place better than what you are today. And even if he doesn't teach you anything new, right, he will at least revise it for you. So don't underestimate any teacher, or for that matter the teachers of your college. Understand that they are there for a reason, and even if you don't learn anything new, they are at least revising it for you. So go with an open mind, and sometimes you'll find gems. You'll find gems of information from the teachers you never thought you would find information from. So don't miss college classes.
Okay, Ranjan sir, quick fire question for you. Second year student who's starting to prepare right from day one when he enters second year, versus second year student who has wasted 6 months roaming around and enjoying the honeymoon period of MBBS, that is the second year. How should they approach pharmacology differently? Or say 1 year into second year, they just have 6 months to prepare. Would you still recommend them to read the books, or will your videos be sufficient for the exam?
सर ये लॉकडाउन में कहाँ रोमिंग अराउंड कर रहे थे, ये बताइए पहले.
Sir, वो तो आप ज़्यादा जानते हो. You have a stronger connect with these students, and I see a lot of these interesting posts on your channels. So,
all right, guys. So it's all about how much time I have in my hand, isn't it? So if you have lost a lot of time, in that case, let us say 1 year is gone and you know nothing ABCD of pharmacology. In that case, guys, selective case, you can rely on the notes and videos, and it'll help you to get through the exam, no doubt. I mean, I'm not saying that it'll not help you to get through the exam, but if guys, if you are just beginning with your second year, then please take it seriously. And this is the exact case where if you study like this, you'll end up in a final year when you don't remember anything about anat, physio, pharma, patho, micro, biochemistry. You'll not remember anything. If you study from exam to exam, no guys. Make it a habit of studying each day, every day, and don't study in bolus. Now, what you're asking me is you'll cover the entire pharma in 6 months. It's a bolus study, and when you study bolus, you don't have much time to absorb these things and retain these things. When it is spread over a 1 year or 1.5 year, and you study gradually, you study and revise, there is a higher chance of retaining it, right? So nevertheless, if the time has already passed and you have wasted so much of time, then you can rely on the videos and notes, because in that case studying a textbook would be counterproductive, because you'll be able to study only half or one fourth of the topics. So yeah, sir, in that case selectively they can use it.
I appreciate how Dr. Ranjan sir has conveniently used the word bolus and absorption in explaining the problem here.
Pharma
I
is
leave
God.
I leave pharma, sir.
Right.
So
How
next
to,
question, Pharma sir,
yes.
Rohan sir.
So, how to manage PG preparation and professional exam in the present situation, sitting at home? Is the approach going to be different? I guess over the last 2 or 3 questions, we've addressed this question in detail. And whatever points I had to share, I think so I've already shared with you. Would you like to add anything, Dr. Abbas, Dr. Ranjan?
One
Yeah,
thing I
I'd
would
like
just like
to.
to, sir, first, Ranjan sir, please.
Yeah. So, guys, I'd like to just add one thing here, that is the approach going to be different? See, the problem now is you're living a life now which you had never known or never seen, right? So, there is a lot of anhedonia around. You'll not be enjoying things. And in these times, it happens, we humans, we try to find excuse to lower our guard sometimes, right? So, we always try to blame it on something. I failed second year because COVID tha, right? My wife has left me because COVID tha. So all whatever problem we have in our lives, we always try to blame it on something. So don't find that excuse. Don't make it an excuse to not perform at these times. So here you have, because apart from the normal times, you have to boost yourself more in these times. And for that, guys, you have to give yourself a daily target. Yes, a daily target, even an hourly target. So if you have, so let us say, 8 or 10 hours of productive day, you need to give yourself, this is what I'm going to cover in these 10 hours. And so every hour, this is what my target is. So guys, by doing this, what's going to happen is you will know how much I have to work. And guys, once you start following this timetable, you will see that your productivity is going to increase. And this is something which becomes even more important nowadays. Second thing is, I would like to explain to you that, see, in Marrow we have QBank, we have test series, we have pearls, we have videos, etc. All these things. So if by preparing from one source you are getting bored, let us say I'm seeing videos and I'm revising my notes. If I get bored, what I'll do is, do not just continue. You are getting bored, nothing is entering into your brain, but you still would like to continue. No, stop and shift to the QBank. Right, whatever you are studying, try solving questions, or try to give a mock test, or try to go through the pearls. So try to keep changing the modes as well as it suits you, so that your interest is maintained. So guys, yes, these are difficult times, but you need to keep pushing yourself towards the goal. What do you say, Dr. Abbas?
Absolutely, and there is in the words that Ranjan sir said, I'll just reiterate it. Make targets daily, weekly, monthly, whatever it is. Targets hai, that you will have an end point to your preparation and this misery, and that's how you'll work towards it. And if you're not motivated, we have a lot of marathons coming up, and we still are running a marathon now where you do parts of question bank in a day, so that you are still in touch with the books. The only thing that I would like to add that was not discussed is that for professional exams, the presentation is a little different from your PG entrance exams. So for that, you need to start, writing templates to build your essay answers on. So for example, if it's an anatomy question asking about nerve, so for all nerve related questions, you should have, a template that if a question is asked, I will write the course of the nerve, the relations, the sensory and the motor distribution of the nerve, and what is the manifestation, whether in terms of sensory or motor loss, if the nerve gets injured at this point, this point, and this point. Examiners love clinical correlation, whether it's anatomy, microbiology, pathology, physiology, it doesn't matter. Any subject in the first and second year, if you write clinical correlate to that piece of information, examiners love it, right? So do that. Okay. So coming to the next question, a lot of students here in the comments are telling, please give strategy for FMG students. I'd just like to tell you that this is it. There is no difference. This is the strategy that you should also use. So when we talk about first, second, and third year students, we are not only talking about two Indian medical graduates, we're talking about all the first, second, and third year students. And come next, all of you will be facing the same exam. So whatever we are talking about today applies to you as well. Please don't think that you need a separate strategy session. Anyways,
Yeah.
so this
Can I
question,
just add one thing? Sorry, Dr.
yeah,
Bas.
sure,
So
sure.
for FMG students, and Dr. Ranjan would agree with me, that the next exam is going to be more challenging because the level of questions are going to be higher. But like I've always been saying in all my sessions for FMG, that this is like a bonanza offer for you. It's a two-in-one offer. Right now, you have to clear your MCI screening exam and then clear the PG exam. But here, you can achieve two things by clearing one exam. You can get certification and you can get a PG seat as well. Would you agree with that, Dr. Ranjan sir? Isn't it a great opportunity for FMG students as well?
Yeah, guys, it's the same coin, and it depends upon which side of the coin you're looking at. And if you look at the brighter side of this, is yes, I mean, see, because the things have not been yet implemented, you might it might seems to be a complicated system. But see, nobody will do something to harass people or to increase difficulties. It is being done so that everything is standardized. Right? No matter wherever the person has studied, India, abroad, which state, which country, so they would be going through a filter. So they're applying just a filter. You go through this filter and you get your license to practice medicine, as well as if you're worthy enough to get a rank, then you'll get a seat for PG exam as well. And remember, guys, there was time when there was no MCA exam, right? 2001 was the year until which there was no MCA exam. So students used to come, they used to practice. Now exam was implemented. Now students come, they give exam, though the passing rate is not that high, but still students, they do pass, right? So which means what? Take it from me, there will be next exam. It's not that all of a sudden you'll see MCA students will stop passing next. They'll they'll still they'll still keep passing next, and the result would, it might alter up 1 or 2% here and there, but students will still keep passing next exam. So don't think that by making next exam it is going to be something different. So if I say it's a cricket match, the stadium might change, but they won't ask you to play football or hockey in a cricket match. Are you getting my point? The essence of what I'm saying. All right, so
Right.
we can move on to the next
Next
question.
question I want to ask Dr. Rohan, because I like how he starts with this. For a second year student, if Marrow brings a new edition every year, how will we adjust to this change, sir?
So, sir, change is the only constant in medicine,
I love
and
how you say it every time.
so, and that is true. What my professor used to say was that only everything in life keeps on changing. The only thing which settles down is dust, and you don't want to become dust, right? You want to be evolving. This is an evolving science, and change will keep on happening. Now, as Ranjan sir mentioned, that nobody is there to torture you. We don't enjoy bringing out new stuff or taking out a new edition every time. We don't want to torture you. But that is the reality. If you don't adapt, you're going to perish. So you need to adapt with the changing modules, changing concepts, and every time something new is introduced, we are going to introduce a change in the module, right? Now, as Dr. Ranjan said, that your notes are going to be with you for eternity, right? Well, at least for 5 years till you crack your PG exam. So the notes which you make in first and second year, by the time you are hitting final year, there are bound to be at least 10 to 15% changes which are going to be there. And how do you incorporate those changes in your notes? There are multiple resources. You will not have time to read a standard textbook for the second year subject again. So you can utilize the Marrow Pearls and the QBank, where whatever updates are coming, they are highlighted. In the videos, every year faculties are adding on more points. But supposing the recording has happened and something just comes up 1 month before the exam, say changes related to COVID, so they will be highlighted as a separate session, or in the Pearls and the QBank, and you can just add them to your notes. So you still have that comprehensive register which you can refer to. Over to you, Dr. Abbas.
Absolutely. I can't put it in any other way. What sir has said is perfect. Change is the only constant. But please understand that when things start changing, you don't even immediately have to go back and watch the whole video again, write the whole notes again. No, you have the basic fundamental information with you. And it's just like sir said, 10 to 15% of updated information will be added, and you can learn these changes or these differences from the question bank. Question bank is a dynamic tool. It is constantly being updated, changed, modified for the betterment, to improve the quality, to replicate the exam. So just by doing the question bank, you will be acquainted with the changed information. Attempting the grand tests, every new grand test will focus on the concepts that are probably going to be asked in the exam. So that is another way of picking up the new information. And also there is a Marrow update newsletter which comes out every fortnightly. You can go through it if there are a few changes. But rest assured, if you stick with Marrow, even if there are a lot of changes, you will get to know about it, right? But also at the same time, don't worry too much about it, because that is not going to make the bulk of your score. The bulk of your score will come from the same information that has been tested and asked multiple times. But to be among the top, you have to have that edge, and that edge has to be given to you. It will be unfair on our part if we do not give you that extra edge. That's why Dr. Deepu always says that Marrow students are burdened with a lot of information, a lot of extra edge information to keep them extra sharp. And it's only when you start revising that information you will be in the top league. What do you think, Dr. Ranjan?
Yeah, see, as both have said, that change is the only constant, and everything changes, guys. So if you buy a textbook, you know that after 3 to 4 years, it is gonna change. A new edition is gonna come, right? So, I mean, does it mean that you will stop studying a textbook because a new edition will come? No, right? So the same thing applies here. And see, what happens is, as it is, when you go to a final year and you'll prepare for your next or NEET exam, whatever it comes, you'll be solving the Q banks. And see, the videos, they change every year, right? But the Q bank is quite aggressively changed every month. If there is some major update, then the questions, the answers, they change or new questions are added. So every month, or as time permits, the Q bank is updated regularly, so that if I go to final year, whatever changes are there in the last 2 to 3 years, and while I solve the Q bank, what happens is I'll come across those changes in the Q bank. I just don't need to do anything. Just take those new changes from the explanation, add it to my notes. Suppose the drug of choice for some X disease was vancomycin. Now it has been changed to some daptomycin, let us say, for example. So I'll just go to my notes, cross vancomycin, write daptomycin, and I will be done with that, right? So it is much more easier. It will be much more easier because the digital format, which is now currently is being given to you because of these current times of advancement, it's going to actually make your life much more easier, guys, right? So I think that covers
one more thing I would like to add, Dr. Ranjan sir, sorry, is that everything is changing and you are also changing, right? You will not be the same person you were in first year. You'll be the person who's in final year. Your knowledge, your understanding of the problem will also, change significantly. If you're a final year student and I keep telling you the basic information from first year, you will laugh at me. You will not be satisfied. You would want more. So everything is changing. You are changing. Content is also changing and improving. But rest assured, if you stick with us, you will have the relevant information as something that you can quickly top up in your knowledge base. Back to you, Ranjan sir.
All right, so we can move on to the next question, I think.
Ranjan sir, so
Yeah.
a lot of students are asking, and if you could just quickly answer it for them. A lot of them have watched our edition 4 videos, and now edition
Okay.
5 has come out. They are asking that, with keeping in mind the NEET exam, which will happen in a few months' time, how should they approach edition 5 changes? They can't watch the videos again. So how do they supplement that knowledge?
Guys, you don't need to sweat over it. Don't lose sleep over it. Whatever you have watched in edition 4, it's done. Switch to edition 5, watch in edition 5. Right? There are changes, etc., which I've already said, they're usually covered in the Q bank. See, the Q bank is so beautifully curated in Marrow that it covers almost everything, including the new changes. So while you go through the QBank, you'll find those changes, and if it is a major change, it would be included in the QBank, and you can update your notes which you had for the fourth edition. Now, I'll never advise, never ever in this lifetime, guys, to re-watch those videos because it is gonna be counterproductive, right? The chances, the changes are there, but the changes are not humongous. Like I would not say that 40% of the content has changed, right? So that means what? There is certainly change, but that change you can compensate by doing the Q bank, which all of you are gonna solve the Q banks, right? So don't worry about that. Don't sweat over it, right? So just shift to fifth edition. Whatever is done in fourth edition. Now you can do the rest from the fifth edition. So, sir, I don't think they need to worry about it. It's not a very major problem. So, can we move on with the next question? Can I get only 3 subjects which are needed for second year, third year? I don't need all the 19 subjects. So, guys, in Marrow, what is our our goal is to make you guys integrate the subjects, study with integration, right? So, for example, if you are studying anatomy, so correlated with physiology, or if you're studying pharmacology, and you're not able to understand some physiological aspect of a disease, go back to physiology. So we want you guys to integrate and study. So that is the reason why these 2 subjects or 3 subjects packs, they are not being allowed, because we want you guys to focus more and more on integration, right? And not blatantly, because we just don't want you guys to mug up things and go through the prof exams. We rather want you to retain the information for a longer period of time and come back to those subjects, revisit those subjects which you are not able to recall, right? So other than this, I think Dr. Rohan would be able to guide you better about this aspect.
Well, as we've been talking about integration and you becoming into a complete doctor, to become a complete doctor, you require all the subjects and you need to integrate all the subjects into one. Just getting 2 or 3 subjects might not put things into perspective, is what I have to add to what Dr. Ranjan has said. Dr. Bus.
Absolutely, I agree with both of you. The reason that you need to get all the subjects together is so that you can quickly review if there is something that you don't understand from one particular aspect of a subject that can be integrated with the other subject. Moving on to the next question. What is the ideal time to start solving question bank from first, second, or third year as an MBBS student? So I think all of us will again have our own opinions here, and that is what gives you variety of information. See, for me, after reading a topic or attending the class of whatever topic that is being taught in your medical college, or watching the video. So after these 3 primary sources, any of them, you can go back to the question bank. Because for me, question bank is always a learning tool. And I see this among many students who are afraid to attempt the question bank, is because they feel the question bank is basically testing their knowledge. And if they don't get a good score, they are poor students. It's not a testing tool. For tests, we have grand tests or subject-wise tests. This is a learning tool. Question bank is a learning tool. You will learn what is important, what are the concepts, and what are the facts that you need to keep in mind. Also, if you look at the design of the question bank, like how Dr. Ranjan sir has said, it's nicely curated so that when you start doing the first question to the last question of that module, you will start learning one fundamental concept or fact, and you will be shown different facets or scenarios of that concept over the questions. And that way, you will be able to remember it more. So for me, I suggest doing it from any year that you're in, first, second, or third, after you read a topic or watch the video. What do you think, sir? Rohan, sir?
Well, that I think so. That's your favorite line, that QBank is a learning tool, and I would agree with that. And as Dr. Abbas has clearly mentioned, that use it as a learning tool, and partly as an assessment tool also, which he's mentioned that once you watch the videos, if you get more than 70% questions correct, your concepts are clean, are good. If you get less than 70%, you need to revisit the videos and see them again to build better concepts. Having said that, first, second year, is it mandatory to solve the QBank? No, it's not mandatory. What is very important is to watch the videos in first, second, third year, make good notes by the end of that year. If you have spare time, definitely visit the QBank. Again, your final, the exam which was going to get you a PG seat is all MCQ oriented. So the sooner you start solving it, you will be much better off than your peers or your companions when you appear for the exam. So if you have time, start solving it as soon as possible. But first, finish the videos, make good notes, understand the concepts. Ranjan sir.
So, guys, I would just like to add one point here that why solving questions is important, right? I mean, what I have learned from my own experience, that is, whenever I would go through the theory of a particular topic, and then I would immediately solve questions. Now, one thing is that I would learn how the theory can be applied into question, or how questions can be formed from the theory. So I would know that which are the parts I need to focus more on. Second thing, which was a surprise and a surprising benefit, that is, I would study a particular important point, right, and I would solve a question related to that. Now that point would stick in my mind forever, for a very long period of time. So that is a beneficial effect that I have seen myself while doing this. So practicing question has its own benefit, right? It helps you retain things for a longer period of time. So guys, I would say you should start solving questions as soon as possible. So see, just suppose I'm starting with anatomy, so I'll go with an upper limb, right? I've studied upper limb, and so I'll just go to the Q bank and start solving questions from the upper limb. So I would have an idea as to how questions can be asked from this upper limb. What are the points that I need to focus more on? So yeah, I mean, if you have time, guys, Q bank is gonna make a lot of difference. So if there are two students, one who has studied theory plus done Q bank from the very beginning, another one just studying theory, not doing Q bank, you'll see that the first one is gonna excel in a much more better way. Right. So that's pretty much what we had to cover. And guys, if you have any questions, any more questions, you can let us know, and we will be answering your questions live now.
So this is the rapid fire round, and I have a few questions for you. I've been reading the comments. So somebody is asking, Abbas sir, only notes are sufficient. Can I skip watching the videos? Your take on that?
So again, I'll come back to the principle here. The litmus test is your question bank. If you read the notes and you do the question bank, and if you're able to break that threshold of 70%, it again means your concepts are solid and you don't need to waste time. But if you're not scoring that much, it means there's a lot of gaps in your information. Go to the videos, fix it, patch it, and then go and solve the question bank. So don't think that you always need to watch the videos, but you need to assess yourself whether you're up to the standard or not by doing the question bank. If you're crossing 70%, you're good to go. If not, go reinforce that information from the videos.
Sir, will this advice be the same for a first, second, third year student also, or would this advice be more relevant for somebody who's in their internship or appearing for the exam this year?
So it would actually, if I look at this question, it would actually depend upon how much time one has. So even if students, they ask me that I'm an intern or post intern, I have never prepared seriously. I have only 4 months left till the exam, and what can I do? Now, obviously, I cannot say him go and watch all the videos. So I advise him the best thing that you can do at this time is just go for the revision videos, so that at least you stand a chance to get something, at least something, a pre-paraclinical or a DNB or something. So it all depends upon how much time you have. Now, if you ask me, guys, if you ask me from my subject, pharma, if you say that if you'll only go through the notes and not watch the videos, I mean, it would not be that much productive. The reason being, you will not be able to learn the certain important things or crucial. For example, one simple thing is, a lot of students, they ask me this doubt, which I cover in my lectures, right? But still they ask me this doubt is, in hyperreninemic hypertension, we use ACE inhibitors, but ACE inhibitors also increase renin. So why am I using a drug that increases renin in hyperreninemic hypertension? Now, such are things, guys, you'll not be able to get yourself. So this is what I explained to you with the help of comparative antagonism from biochemistry, coupling it with pharmacology. So that is what I do, guys. That is what you should do. I take it on myself. So as far as my subject is concerned, guys, pharma, if you have time, or advise you to go through the videos, right, and then make the concepts. But again, if you don't have time, if you have less time, guys, you can go through the revision videos or just notes, I mean, as Abbas sir has said, you can evaluate yourself based upon QBank.
No, I think what your point is absolutely correct. Why would you not want to watch the videos? That is the question, actual question. Why would you not want to watch the videos? The videos have been, right, they have been designed in such a way that they will teach you the concepts and facts, everything so nicely in a fashion that you will not probably pick up easily from the notes. Understand that the notes are a condensation of the information that is given to you in the videos. Videos has the backstory, videos has the context, videos has those clinical stories and tidbits. I remember from one of the Dr. Rohan sir's videos where he shows a donut and he talks about the donut sign. That kind of memory will only be established if you watch the video. So if you have time, like sir said, definitely watch the videos. You'll be blown away by all the teachers on the platform.
Okay, another question. There are a lot of final year students who've joined us, and final year students are asking, is the strategy different for us? So my personal take on this, again, I am telling you a very simplified thing, that by the end of final year, you should have all your 19 registers. That means your notes. Now, whether you're handwriting your notes or you're using pre-made notes, which Marrow provides, you need to supplement them with the knowledge which you've read from the books, Pearls, QBank, your college classes. That would give you comprehensive notes for all 19 subjects by the end of final year. When the next exam is implemented, the exam is going to be after final year. So your notes should get completed at least 6 months before the end of your final year, which is why you would start to read clinical subjects from third year itself or end of second year itself. So that would be my strategy for current final years and for those who will be appearing for the next exam. Any additions?
Totally agree with you. Absolutely agree with you.
That's all. One student was asking one question that I saw is which textbook to follow for pharmacology in second year. See guys, it depends upon, if you ask me, my go-to textbook is, I love Kazan. I'm saying as an undergraduate, as a postgraduate, I loved Goodman Gilman, but I'll never advise you guys as a graduate students to go with Goodman Gilman, because it's an ocean of information. You'll drown in it. Right? Don't go to Goodman Gilman. You can go for Kazan. So as an undergraduate students, I loved Kazan. Kazan is much more, the information is palatable. If you want to go for Indian author, you can go for KD Tripathi or KK Sharma. Right? Personally, if you ask me, I prefer KK Sharma more than KD Tripathi. So it's up to your choice, guys. Either Kazan or KK Sharma or KD Tripathi.
Abbas sir, which is your standard textbook in orthopedics?
I think for orthopedics, I mean, this session is exceptionally for first, second, and third year students. But again, if you start orthopedics early on, the standard book available for all undergraduates is Maheshwari. There is no doubt about it. But the point, or aptly for that matter. But again, what I want to just say here is that you pick any book. Don't be afraid of picking up standard books. Don't be afraid of picking up big books. Don't be afraid of picking up foreign authors. The teachers on the platform, on the Marrow platform, will make it so succinct and easy for you that you will be able to digest the information in any book, from any book, right? So a lot of people have this fear of picking up Robbins in pathology. Trust me, if you watch Dr. Ila's videos and then go back to Robbins, or if you do it other way around also, the information will be palatable. A lot of students are afraid of picking up Bailey because it's so thick and fat. Don't worry about it. Everyone knows that Dr. Rohan sir has made Bailey so easy, and all the information from Bailey has been nicely put in his videos. So don't be afraid of picking up any standard book. Understand that we are there with you. And when you watch the videos, the information will become sublime and easy to consume.
So as Dr. Bas has said, Bailey is the go-to book for surgery. I prefer Bailey over SRB because a lot of questions are directly framed from Bailey. As I've already told you, Bailey can sometimes be very difficult to understand upfront for an undergraduate. So watch the videos, then read Bailey. You'll be able to understand it very easily. Another question which a lot of students are asking, and this is a constant one which all of us have answered at various platforms, but let's just quickly summarize it. Should they make their own notes, or are pre-made notes sufficient? Dr. Bas.
Well, I think again, this depends on where you are in terms of your preparation. If you're starting early and you have ample time, I think the whole exercise of writing the information, listening to the videos, watching the teacher teach you, assimilating the information in your brain, and rephrasing or paraphrasing the information and putting it on the piece of paper, that whole exercise of input, process, and output will make you remember things for a very, very long time. And I am a firm believer in writing stuff down. But if you do not have time, or if it's getting too tedious for you, which I think if you are lazy you should change that. If it is getting too tedious for you, yes, you can take ready-made notes, but make it a point to follow it and add information which you process and paraphrase in your mind to make it your own. I feel that my notes should represent me in terms of the language that is written on the piece of paper. So that's my take on it. What about both of you?
Well, see, as I'm always a firm believer of writing my own notes. So it's kind of, for me, writing a note is like building a house. And I should know that what is the way, how many rooms are there, and if I could close my eyes, I could move around the house. What I mean to say is, when you write your own notes, revise them multiple times, and one day after 4 to 5 revision, when you close your eyes, you can actually flip through your notes in your mind. Now that actually happens, and it happens with your own handwritten notes. It will never happen with printed notes, right? Second thing is, if I go back to my school days, right, I had a chemistry teacher, right? He was a great teacher, and he used to tell us one thing every day, that one time writing is equal to 5 times reading, right? So it means that when you write something down, when you write down something, that means it there is more chance of that particular information to get into your permanent memory. Second thing, guys, remember, it is always much easier to revise own handwritten notes as compared to printed notes, or borrowed notes or Xerox notes or whatever notes they may be. So your own notes are the greatest treasure, guys. So if you have time, right, try to invest some time in making your own notes. Otherwise, you can go for printed notes. I mean, that's up to you. So if you are starting early in the first year, you have ample amount of time, invest the time in yourself. I'll say that.
So I would completely agree with Ranjan sir. If you have time, make your own notes. If you don't have time, pre-made notes, supplement them with additional knowledge. And visual impression, which sir has highlighted, is very important. I can tell you this from my personal experience while appearing for entrance exams for USMLE. You know, sometimes when you were stuck at a question, you just close your eyes. You will remember that this point was written on this side of the page. It was underlined with a green pen, and this is the thing which I had written there. So that's what you remember. You can easily answer questions. Abbas sir, one more question which a lot of students are asking, and this pertains to clinical medicine. They are asking, how should we approach clinical subjects in second and third year? How should we start reading orthopedics or surgery or medicine from second, third year?
So ideally, in any medical college, the clinical postings usually start from second year itself. So you're basically asked to, take history, and examination probably starts later in second year or early third year. But your history taking is what starts in second year. And you also have those specialty classes and surgery and medicine and OB-GYN classes that start in second year. So what happens is, when you start your second year, you'll start reading pathology, you'll start reading pharmacology and microbiology. These three subjects alone will not give you the full picture. Once you start putting these three subjects in context of a patient, that is when you start understanding what is going on. So I wouldn't suggest immediately start picking up the big books of medicine and surgery and obs and start reading it. But I would definitely suggest that once you go through a disease in pathology, go to the clinical book, whether it's surgery or medicine or obs and then look at the clinical features from that clinical book. Thereby you get an understanding of how that pathology manifests into that clinical feeling, clinical presentation. Look at the diagnostic tests, whether it is a lab test which shows a certain elevation in enzyme, so you can go back to biochemistry and understand where that enzyme came from and how it matters in assessing the prognosis of the disease or the severity of the disease. That's how you can go about it. If you're going for the examination of an orthopedic patient, or you're looking at an x-ray of a fracture, go back to the anatomy and quickly see which bone is being represented on x-ray in AP view or lateral view, and what is the fracture pattern and where is the distal fragment getting displaced. So going back and forth with little information of the clinical subjects will add more masala to your dry khichdi, or tasteless khichdi, and then you will start having more fun. What is your take, Dr. Rohan?
So what I used to follow was very simple. From second year, when the clinical posting started, whatever I used to see in the ward or whatever was taught in the college that day, which was clinical, I used to come back and try to read that from the standard textbook of that subject. We did not have Marrow at that time, so I did not have Marrow. But so that is what I used to do. I used to read it from the standard textbook. If I saw a case of a hernia, I would come back, read it from Estas, the examination, and some theory part from Bailey. So if you can just do this much, if you can gradually build on this clinical knowledge, so every day if you see one or two cases and you come and read about them, you can easily cover up majority of the important subjects before you enter final year. So Ranjan sir, a question for you. A lot of students are scared with your bolus and regular infusion thing. They are saying कि हमने time waste कर चुके हैं. अब समाधान बताइए, solution बताइए.
Right. So, guys, if you have wasted too much of time already, then obviously, I mean, if you don't have time now, then you can skip the textbook part and you can go through the videos, and you can go through the notes. And I mean, that will save your life. I'm not saying it's not enough. It's enough. But see, reading a textbook, what I meant is, for every subject you should read a textbook, because reading a textbook should be a part of life of a clinician, right? Tomorrow you will be a clinician, and whenever you go through the textbook for a particular topic in a broad way, you'll still pick up some points and your sense of understanding would be little bit different. But anyways, guys, time has passed by, water has flown down, right? So now nothing to worry about. If you don't have much time, go through the videos, go through the notes, and if you have time, you can make your own notes. At least if you have time, make your own notes. That way it would be much more productive, right? So make your notes, go through the videos, then solve the Q bank or give the grand test. Whenever you're solving Q banks, you always might find some new information. Open that page of your notes, add on to that particular page. So whenever you write down your notes, in between keep one page after every 10 to 15 pages where you can add on something to your notes or leave some space in that page, right? So by that way you can compensate for this thing as well, guys. So nothing to worry, guys, nothing is lost. All of us, we wake up sometime and we think that already this is something that has happened to me and how to go about it. But it's never too late. It's never too late to compensate, and but certainly you have to make changes accordingly to that. Any more questions, sir?
Right. So one more thing which is constantly coming up, students are asking that if we have a doubt regarding what we've seen in the Marrow videos, where do we ask the faculty members those doubts? So there is a common platform called the Marrowlinks group on Facebook, Marrowlinks group. So you can put in your request to join the Marrowlinks group, and all academic queries will be answered by all 19 faculty members there. So if you're not already a part of that group, please do join that group. It will be helpful for you. In addition to this, all the faculty members also maintain their own social media handles, and you can ask your queries there as well.
So one question one student has asked:
So
how to know which drugs are more important as compared to others for our exam, right? For next exam or NEET exam, whatever it is. Now it's very simple, guys. It's very simple. Just think, whenever the examiner makes a question, is he gonna make question from a drug or regarding a disease which is frequently seen, or a drug which is rarely used? What do you think yourself? Obviously, the drug which is more commonly used. So let me talk about anti-epileptic drugs. The most commonly used in India are which one? They're valproate, carbamazepine, phenytoin, these three. Lamotrigine and all, they are also used, but they're not that commonly used, right? So which means what? Majority of our MCQs in anti-epileptics, they are directed towards these three drugs: valproate, carbamazepine, phenytoin. Second aspect is, so when I said which drugs are more commonly used, MCQs would be asked. Second is, if a drug has a very complicated mechanism of action, a lot of side effects, right? So those drugs would be asked. So let us say, for example, digoxin. Digoxin has very limited use in chronic CHF. Only it is used. It is not used in acute CHF. But it is hell of a complicated drug. It is such complicated drug. It does a lot of things in your body. So digoxin is a gold mine for MCQs. So they love to ask. Same is with lithium. Lithium is a very complicated drug. So they ask a lot of MCQs on lithium. So guys, this is what happens. So when you try to analyze actually from these point of view, and you can see that from the Q bank as well. In Marrow, the Q bank has been proportionately dedicated to how the questions are asked in the exam, right? So the questions you'll find in the Marrow Q bank, they are more concentrated toward the more commonly used or more commonly associated or diseases that can be seen. So in India, for example, I want to make an MCQ, right? Would I go for making an MCQ on diabetes, or would I make an MCQ for Chagas disease, which is not seen that in India? So I'll obviously make an MCQ in diabetes. So in any exam, you'll find at least one MCQ, at times 2 or 3 MCQs you'll have from diabetes mellitus, right? So that's very simple. Whatever questions are asked in a country, it is more limited to what is seen in that country. Regarding a drug, which drug is more commonly used? I hope I have answered your doubt.
Okay, so sir, another question which students are asking Abbas sir is that they want us to summarize for each year what should be their preparation strategy. I think so we've highlighted it again and again, but just to put it at one place, we'll start with first year. Why don't you tell about first year? What should a first year student do, keeping next in mind?
Right. See, we've talked about this. So in summary, first year you have anatomy, physiology, and biochemistry. If you can manage to finish these 3 subjects in this changed environment that you have immediately moved on to into a medical college, the change in life is sometimes dizzying. If you can manage to finish anatomy, physiology, and biochemistry and have their notes ready, and you've understood what you have watched either in the form of videos or what you have read in a textbook, and if you begin to touch the question bank for these subjects, I would feel that that is an enough preparation for first year MBBS student. So finish watching the videos and making the notes. This is your first priority. Get acquainted to the information. If you have time and you are well organized, go through the question bank also. If you can manage to do this for 3 subjects, for me, your first year is well spent.
Perfect. Ranjan sir, second year.
See, guys, second year, the 3 subjects which we have mostly pharma, patho, and micro. See, as we have already discussed these important points, as far as pharma is concerned, guys, I have said make a combination of your textbook and video lectures and go through them, try solving the Q bank, and make your own notes. And your notes, they will keep on changing. So you're in second year, your third year, fourth year, the new points which you keep on getting, right? Do not feel shy to go back to your notes, add on those points, and keep moving forward. Now, pathology, guys, pathology is the backbone, is the backbone of medicine. So how your medicine is going to be strong, it depends upon your subject pathology. And for that, pathology has been covered beautifully in Marrow, guys. So go through the videos of Dr. Ila and the first 7 chapters of Robbins. At least that is what you need to do, minimum, right? So inflammation and cell regeneration, etc., those topics. So those are must from Robbins. Add on to that pathology. Microbiology, guys. See, microbiology, one thing which I found during my preparation is, I would get lost just in the classification, gram positive, gram negatives, aerobes, anaerobes, this and that, right? So what I used to do to get a bird's view, right? To get a bird's view on micro, I took a big chart paper, make a classification of gram positive, negative, aerobes, anaerobes, all the microbes, and everything I tried to fit in the culture media, the appearance, everything into that one chart paper. So I had one chart paper for bacteriology. So I could just look at one chart paper, and I was actually encashing on pictorial memory. Guys, we usually encash on word memory. We try to remember words, but here you're remembering that picture, right? It will be engraved into your memory. And that is how you can actually master microbiology, by making at least 3 to 4 chart papers, One is for bacteriology, one for virology, one for your helminths or fungus, whatever it is, guys. So that is a way forward to retain micro, because it is one of the most volatile subjects. Patho is juicy, isn't it? It's juicy because it flows like a story from one step to another step. You find it interesting, but micro, you somehow you tend to get lost in the jungle of classification itself. So this is, guys, how you can master the second year subjects.
So second year, Ranjan sir is saying again, watch all the videos, your notes should be ready. You should integrate pathology with medicine and surgery. So continuing where Ranjan sir left, pathology forms the backbone of medicine and surgery. There will be things which are covered in pathology, but the clinical aspects are not covered there, or the management is not covered there. The management would be covered in Dr. Rakesh's lecture or my lectures. So if you've seen a case and if you want to go up till the management, after watching Dr. Ila's lectures, you can watch our lectures to round off things or to complete things. But if you just want to watch see the pathological aspects and the clinical presentation, Dr. Ila's lectures would be sufficient. Moving on to third year is the time when, so one more thing which students are saying, that the second year time has now been reduced in the new curriculum. It has been reduced to 8 months. So trust me, we all have been through MBBS. The first 3 to 4 months of second year, all of us waste. Okay, all of us, that is called the honeymoon period. So instead of now wasting that time, you need to utilize that time more fruitfully for your preparation. And in 8 months also, you can finish what usually was being finished in a longer duration. Moving on to third year, you need to, again, first priority, finish the third year subjects. And your second priority should be to dig deeper into the clinical subjects, that is obs-gynae, surgery, medicine, and pediatrics. And other subjects, orthopedics, dermatology, radiology, will all be a part of your postings. Whatever you see in the posting, you need to come back and watch the videos for that and add to your notes. One question which a lot of students are asking Abbas sir and Ranjan sir, they did not make notes in first year. Now they are in second year, or a second year did not make notes in first year and second year. Now they are in third year. How can they cover the subjects which they've missed out on? Is there a strategy to cover up time? Abbas sir?
I think let bygones be bygones, and like Rohan sir said, wherever you are, you start from there. If you are in second year, you start making notes from second year. If you're in third year, you start making notes in third year. If you're efficient with your time, if you're committed to the agenda, you will make time for the subjects that you have missed out. And if you can go back and prepare those notes, amazing, great job. If you can't, you have ready-made notes and you can just add information to it. But the year at hand should not be sacrificed for making notes of the previous year subjects, because this year you have to clear your professional exams as well. And since everybody is studying those subjects, you will be bored if you go back to reading the first and second year subjects. So that's my take. What about you, Ranjan sir?
Can they take pre-made notes of previous years and watch the videos at 2x or 3x, which is usually the norm, to cover up some bit of it? Is that possible, Ranjan sir?
Yeah, they can do that certainly, because you don't have much time to make notes now. But certainly, guys, to cover up for whatever is lost, don't lose the momentum at the moment, whichever subject you are supposed to go through at that particular time period, right? Then, if you have extra time, you can just follow the. Now, here, see, the printed notes, they can be life-saving in some situation, right? So it is one of these cases. Like, for example, a student who has started preparing during internship, right? So it does not have much time during internship, so you can go through the videos, make use of these notes. Someone has started preparing seriously from second year. Now he does not have time to make notes for the first year subjects, so he can use the printed notes for those first year subjects. And from second year itself, he can move along making his own notes if possible. Now, I'm not saying that making notes is always mandatory, but it is better, because there are different kinds of students, guys. There are different kinds of students. Some students, they would only do Q banks, and only from Q banks also they score a good rank, right? So there are all different kinds of students. So you need to analyze, find out what suits you better. Generalize whatever you are speaking is generalized thing, that mostly making your own notes is beneficial. Don't have time, time has passed by, make good use of the printed notes in this case.
Perfect. So, sir, another question, which an interesting question, is that we've answered a lot of academic questions. We've answered how to prepare questions. Students are asking, how do you how do you tackle stress during MBBS? So what are your tips, Ranjan sir? How do you tackle stress in life?
Well, guys, tackling stress in life, I'm an enthusiast, right? I love to work out a lot, and believe me, in a day, 24 hours we have in a day, right? So those 1 or 1.5 hours I always look forward to is the workout time, and the amount of endorphins which are released in those 1 and 1.5 hours is enormous, guys. Is enormous. I always look
Energy
forward to it.
pharmacology.
Yeah. So it's enormous, guys, because you feel happy. You'll feel happy doing something which you love. So, working out or doing exercise, they do release the feel good hormones. So try to make it a habit of doing any. I'm not saying you lift weights, because I am more into lifting weights. You can do yoga, you can play football, hockey, or whatever you want to do, you can do that. So that is one way of relieving stress. Uh, Other ways of relieving stress, what I do, I don't think I'm going to discuss here. So,
Abbas sir, yes,
Well,
your
I
take
think
on.
stress is a part and parcel of life, and for me, it's all about optimum stress. For example, if we were planning for this session today for the past few days, and it was a little bit stressful for me to get back from surgeries and work and then sit down and plan this session and speak to the other teachers and organize this. But if it wasn't for that stress, I would have not been doing that. I would have been like, jo hoga dekh lenge, and I will just wing it and see it. But see, using that stress to actually help me or help all of us plan this session has made a beautiful outcome like this. So if there is stress that is in excess, yes, you need to find ways to beat it. For me, it's just relaxing, spending time with kids. I used to work out a lot. I mean, you guys might not believe it. I used to work out so much. It was so much fun. But by now, I mean, by operating on those difficult cases and reducing those massive fractures, I get my share of workout in the operation
That's
theater.
enough workout for you for the
Yeah.
day.
What about you, Dr. Rohan? You are an avid cricket player and a gymmer.
Yes, so I mean, I can't lift as much weights as Ranjan sir does, probably lift half the weights what he does. But managing time is very important. And as Dr. Abbas said, that some bit of stress is good if you can channelize it, right? So that channelization of energy is good. Second, very important advice to first, second, third year. Don't think, ये मत सोचो कि exam is 1 year before, so हमारा MBBS पूरा पढ़ने में निकल जाएगा. That's not the case. Please pursue your hobbies, take out time for your hobbies. And these are the hobbies which are going to be really beneficial for you when you actually enter clinical practice. And trust me, a lot of you think the phase which you are going through is stressful. When you enter clinical practice, you'll get to know that that is the most stressful part of a clinician's career, right? For me, it is very important that I exercise. As Ranjan sir said, releases a lot of endorphins. I play cricket at least 2 or 3 times a week. We have a cricket team. We play corporate matches, and I love to spend time with my family. So balancing time is also extremely important while preparation. Last two questions, sir, and then if you people have any questions, we'll address them. Number one, which I want to again take a vote from both of you. FMG students are asking, is there something different for them, or whatever we've discussed in terms of strategy, does it remain the same for FMGs as well? Ranjan, sir.
see, as FMG students, I would say, for many countries, it's a 4 5 years program, right? For many countries, it's a 6 year program. So for Russia, Ukraine, where the program is for 6 years, you are on the, actually you have more beneficial, because you have a lengthier period of undergraduate period of time, where you have more time to go through these subjects. The only thing is, guys, we have a lot of distractions over there, so you need to be focused, right? You need to do everything in life, right? Enjoy, but you need to study as well. So if you begin from the first year, be focused and adequately move forward. The strategy is same, guys. The subjects are same. We are the same humans, right? You guys are not different. You're going to have the same doctor in India practice on the same kinds of patients. So your strategy is not going to be different. The only thing is, guys, I know, I mean, it's difficult to keep the focus. So you need to work hard to keep the focus there and to begin early, guys. As an FMG, to begin early, it will give you much, much more benefit. Second thing, I'd like to ask you guys, whenever you go to the clinics, even as a foreign medical graduate, in Russia, Ukraine, Philippines, China, wherever it may be, in your postings you'll see cases, right? So do not shy away from seeing the cases. So you go through the files, and whenever whatever information you get, x-ray or ECG or whatever academic material they provide you, try to save the digital soft copy, right? And make your notes if possible as to, I mean, what the case was and why this diagnosis was made because of this ECG or why because of this X-ray. So this is going to help you guys. So you need to toil. You need to toil if you want a better result for yourself, right? Because you are up against. So getting a passing certificate is different. You'll get it if you are honest with your preparation. But getting a PG seat is not that easy, guys. You're up against the Indian medical students, right, who toil from the very first day of their MBBS curriculum. There are students, and continuously they are at it, right? So to compete with them, to get your, because see, nobody is giving away a PG seat to you. You have to snatch a PG seat from an Indian medical student, right? So you have to be that good. So, guys, yes, the only difference is, guys, sir, our strategy would be same. I mean, these are the same students. Strategy is not going to be different. The only thing is they need to keep focusing right there, because there are a lot of distractions. That's the only thing I would like to mention here.
So strategy is the same for FMG students. That is what Ranjan sir is saying. Abbas sir, question for you. A lot of students are saying we are drifting towards the USMLE pattern. Should we start solving UWorld and USMLE resources for the next exam?
I'll answer this, but I would like you to answer this as well, because you have appeared for the SMLE exams. See, as of right now, it's still speculation. But if you notice the 2020 questions that were included in Marrow, they were all clinical vignettes, and the focus is drifting towards clinical scenarios, case-based scenarios. But there is one key fundamental difference between UWorld and the Indian MCQ based exam questions is that we heavily test the problems, the scenarios that are faced by Indian clinicians or Indian doctors, whereas most of the UWorld questions will be testing Lyme's disease or yellow fever or the West Nile diseases, these diseases that are prevalent in the western part of the world. But if you can overcome that, I think the more you practice from more sources, the better you get at answering these questions. What do you think, Dr. Rohan?
So you're absolutely right. The disease profile, and as Ranjan sir mentioned, what examiners are going to ask is what is common in the country. So the disease profile is different in America and in India, and a lot of UWorld questions are more oriented towards diseases which are seen there. So the pattern of the question, to understand the pattern and how to solve them, to understand keyword analysis, these resources are good. But all these things are also now being introduced in the Marrow Q Bank. Marrow Q Bank is adding more long stem questions. We are talking about keyword analysis and all the integrated sessions which we are doing. So I would not say it's an absolute must to solve these resources. Again, this can be done if you have time. Then you can see these resources, but otherwise first focus on the task at hand and the priorities which we've discussed in
so there is no limit to the things that you can use to learn.
Correct.
There is ocean or plethora of resources out there, but the point that we are trying to make here is that Marrow is taking the best from everything that is available and providing you so that you can just stick to Marrow and focus on the things that are important rather than keep wasting your time collecting resources.
Yeah. So guys, no, I don't think you need to do that until and unless Elon Musk comes up with a Neuralink USB software where you can upload the anything and everything you want to. So you need to limit your resources, guys. So the the crux is reading or revising the same stuff time and again. And Marrow Q bank is more than enough to tackle that. And you're updating the clinical Q banks and etc. everything. So I don't think you need to wander here and there to increase the load on yourself, right?
I think we can move to closing thoughts. Dr. Rohan, what do you think?
Well, I feel we've summarized the strategy for each year. Stick to what is important, as has been mentioned that there is a plethora of knowledge out there, but you need to prioritize. So plan properly, prioritize, and stick to the plan is what I'm going to say. And you know, as doctors, I've always seen that we start investing very late because we start earning late. But there are few principles of investing that you stay invested in whatever you choose. You don't churn a lot. So whatever plan or whatever strategy you decide for yourself, walk that path. Yes, every few months you need to adjust it slightly. You need to make some investments here, some investments there to adjust your strategy, but you cannot deviate from the path frequently. If you deviate from the path, your returns will suffer. Similarly, in your preparation, choose your path, plan, prioritize, walk that path, keep on making minor adjustments every now and then to optimize your results.
Dr. Ranjan?
Yeah, so
Closing
guys,
thoughts?
I would just like to summarize everything with one of my quotes, that is, never be a part of a rat race, because a lion is never born out of a rat race. So what I mean by rat race is, see, while you are preparing for your exams or doing whatever in your life, you will see a lot of people doing something in their lives. So do not expect to copy them right in the same way and gain same result. So make a plan for yourself in your own life and see what suits you. So the same stands for preparation for NEET PG exam or next exam as well. You need to understand your own needs, what satisfies you more, right? You need to find your weaker points, work on them. You need to identify which are those 2 to 3 subjects which you're weaker in and devote some more time to those, or work out an idea as to how you can master those subjects in a different way, right? So you need to always make your own plans in life, guys. And it does not matter you succeed or not, but at least you're following your own plan and not blatantly copying someone else and expecting the same result. Now remember, you are in one of the finest professions where your patience would be tested to the core, right? And you need to live up to that expectation, right? And with all the stress and all the difficulties in your personal life and all these things, right? One thing that you get at the end of the day is, when you treat a patient, right, you'll see a sparkle in the eyes of that patient when he gets well. So that is what drives the clinicians, right? That is something that could not drive me, so I became a pharmacologist. That's a different story altogether, right? But anyways, guys, I would still say to you guys is that follow your heart, prepare, study hard, and whatever comes at the end of the day, don't worry about that from the beginning. And remember one thing I have seen in my life, I've realized it in my life. If you're honest with something, right? If your approach is honest for something, you'll get at least something in your life, right?
And you are an amazing pharmacologist, I have to add, Dr. Ranjan. Students adore you to bits. So I would like to resonate the thoughts of Dr. Rohan and Dr. Ranjan here, and I would like to end by saying a few things here. First of all, you're in the medical college, right? Whatever it is, getting here was probably a very, very hard journey, and you deserve to have fun. You deserve to make friends. You deserve to enjoy college. You deserve to get into relationships. You deserve to make mistakes and learn from them. You deserve to, to be a stupid for some time and be a fool for some time, but it's okay. But at the end of the day, you should not forget why you're here. You're here to become a doctor, and to become a doctor, it doesn't take a lot of intelligence. It doesn't take a lot of genius. What it takes is, it's persistent hard work. you can, like how Ranjan sir said, you can start a continuous IV infusion of your preparation from day one and have a relaxed college life where you study a few hours every day. Or you can, cry a night before every exam and tell yourself that I will not do this again next year, only to repeat it and not study throughout, and take those painful bolus doses of information and forget it. So it's all up to you. You make that choice. But we here are telling you that the first choice is what is fun and interesting, because you become not only better doctors, but you enjoy the journey. Because trust me, all of you will make it. All of you will make it one fine day, sitting in an OPD looking at the patients operating or doing something. You will make it. But it's just the journey of how long and how painful it would be. And our purpose here with Marrow is to make that journey for you as little, as painless as possible.
So guys, lots of love and blessings to all of you from entire team Marrow, and I'd like to wish all of you all the best, and I'd like to thank Dr. Abbas and Dr. Rohan for enlightening to you guys as well as me with some of the important points of life, right?
So thank you very much. Thank you for your time, Abbas sir, Ranjan sir. It was an enlightening session. If you have any further questions, please do write them in the comments section. We'll be happy to answer those. Again, before we end, Marrowlings group on Facebook is where you can ask your academic queries. If you have any queries regarding the videos, please do post your queries there. We'll be happy to answer them. Thank you. Good night.
Good night.
Good night, guys.